Up to 2% of the population, if they underwent routine CT scanning, will be found to have an adrenal mass. They're very common. Most of these masses don't require any treatment at all. But the primary care physician who sees patients needs to be able to understand under what circumstances these lesions need to be worked up further and, in some cases, surgically treated. The first thing any patient with an adrenal lesion needs is a complete history and physical. Patients who might have metastatic carcinoma need to be screened for that. Patients need to be carefully interviewed and examined to see if they have any obvious endocrinopathy, such as a pheochromocytoma, Cushing's syndrome, or primary hyperaldosteronism, or Conn's disease. These need to be ruled out no matter what size the adrenal tumor is. It's fairly simple to rule these out, although some cases can be equivocal. To rule out a pheochromocytoma, one only needs to do urine and plasma catecholamines. To rule out Conn's syndrome, simply you need to know if the patient's potassium and bicarbonate level are normal. And for Cushing's, the majority of patients who have a normal 24-hour collection for urine-free cortisol will not be found to have Cushing's. Clearly, these conditions come with a typical syndrome, and we should have a pretty good idea if these patients may have an endocrinopathy before we even do the tests, but the tests are important. What's confusing is when do we take these out in the absence of a patient with an endocrine problem. Clearly, anybody who has Cushing's syndrome, a pheo, or Conn's syndrome should have their tumor removed no matter what the size. The literature generally recommends that lesions that are over 4 centimeters should be removed surgically. In the vast majority of cases, this can be done laparoscopically, and the hospital stay should only be 1 to 2 days. These patients who do not get operated on should have their tumor, it's less than 4 centimeters, scanned at intervals to make sure that it isn't growing larger. The lesion that doesn't change and is less than 4 centimeters can safely be ignored.